So for this final video, we're going to talk about controlling our breathing and problems that we see in our respiratory system. So first, we'll talk about controlling our breathing, and what part of our nervous system is in charge of controlling our breathing, and that is our medulla, if you remember from the nervous system. It also controls our heart rate. So if we need more oxygen in our body, our heart will beat faster, but also our respiratory system has to speed up. Right. Other than working out, so we could think of that as chemical factors here. If we need more oxygen or we have too much CO2, so if your muscles are working very, very hard, they're using a lot of oxygen and pumping out a lot of CO2 into our blood. So the only way to really get rid of that CO2 is to breathe faster. So that can cause our respiration to go up. We also have emotional factors. It could be stress. It could be feelings of anxiety. Anything along those lines may cause our breathing rate to either speed up, or they can actually slow it down for other reasons too. Most of the time we talk about it speeding up. We have what's called volition, which is controlling your breathing, and sometimes people that you do yoga or meditate, you're going to be controlling your breathing, slowing it down, but other times you might be very stressed out, or you might have got very mad at something. You've probably heard people say it all the time. Just breathe, deep breath in, deep breath out. That's to control your breathing, and in turn, that slows everything down in your body. That slows down heart rate, and it also calms down your sympathetic division to kind of switch over into parasympathetic, so you can bring yourself back down to normal. Okay, two questions that I ask, which I think are very interesting, is can you stop yourself from breathing after an intense workout, and can you hold your breath to die? Both of those answers are really no. Your body is going to be calling for oxygen and to get rid of CO2 so hard that the internal mechanism in your medulla will just take over and you'll just start breathing. So I'm not telling you to try it, but it is something. You can't just sit there and hold your breath until you can't anymore. It just doesn't happen. It just doesn't work that way. All right, on to our problems or disorders. You've probably seen commercials for COPD. That's an overall blanket disease, and it usually comes from people that smoke or smoke for long periods of time. And what it really brings up is two things. It brings up bronchitis and emphysema. They're usually co-opt with COPD, or chronic obstructive pulmonary disease. So when someone is said to have COPD, they usually have many, many factors that are going into the respiratory system not working properly, two main ones being bronchitis and emphysema. So if we look at the two, bronchitis, and I have a picture on the next page, means that your lower respiratory passage, which really just is your bronchi and bronchioles, they are inflamed, and inflammation means that actually the passageway is squeezed. So if we move forward really fast, see the squeezing here. Inflammation meaning the outside is inflamed. So this area would get inflamed, meaning that it's going to push inward on that opening. It's going to squeeze it out, and you're going to get a lot of mucus buildup in there. So your breathing is going to be hampered. You'll probably get some kind of like wheezing, almost like people with asthma get, but you're not going to get enough gas transport happening down in your alveoli. All right, that can come from being sick. So people during the winter time, they say, go to the doctor, they say, oh, you have bronchitis. That could be from bacteria or virus. That just means inflammation. But if we're talking about that connected with COPD, that's very, very serious. All right. One of the other symptoms of COPD is emphysema. And a lot of people that have emphysema, they're on oxygen tanks. So you'll see them wheeling around an oxygen tank, or they have something in their nose. That means your alveoli are enlarged. So your alveoli are here. This is what normal ones look like, and ones that become inflamed, they can actually scar, and then you get zero gas transport happening in them. So it sets up kind of like a barrier, and you're going to get no gas exchange happening there, which we don't want. It also has a little bit to do with functionality of pressures, but we won't really look at that. We're really just looking at the membrane and how that actually gets damaged due to that inflammation. Two more issues that we see. One is called sleep apnea, and you may have heard of this. Sleep apnea is usually seen in overweight and obese people, means that when they're sleeping, they don't get a normal rhythm of in and out breathing. They get long pauses of no breathing. And not that you would kind of die from it, but it doesn't allow for healing of tissue throughout the night because you're not bringing enough oxygen. It usually makes people feel really tired and lethargic because they're not really getting that deep sleep with enough oxygen coming in to repair. The last issue that we see with our respiratory system is called asthma. You may have asthma, or you probably know someone. That is usually a genetic characteristic that's passed down, or it could be due to allergies during the year. So the fall time or the springtime is rolling around and pollen's going to be up in the air and all that kind of stuff. And that just means that your immune system is reacting, and it's going from a normal airway and it's going to start to constrict. Okay. And it's going to cause a constriction of the airway. It's going to cause inflammation here. Okay. It becomes inflamed there, and that constricts your airway down, and you're going to get that wheezing sound. Especially when you go to the doctor, they'll kind of listen and say, yeah, it sounds like your airways are constricted. And that is something that we were trying to figure out how we can control that. People take medication for it, allergy medication, and it's a constant revolving entity because plants or pollen and the way that our body reacts with that pollen is constantly changing. Our last topic is called the collapsed lung, and hopefully you remember the pleural cavity, which is this lining right around here. Okay, and that kind of wraps around, and we can see it here too. Okay, and you can see normally the lung should be resting right up against the visceral pleura, and then there's a little bit of a membrane there, and then there's the parietal. Well, what happens is sometimes air gets in between those two membranes, and if air gets in there, it's going to start to press in on that lung. It's actually going to squeeze it. So someone that gets hit very hard in the chest, it could cause what's called a bleb, or their little air pockets to come out. And then once that starts, that air that was inside of those lungs is actually getting into that membrane space, and it's going to push in on that lung, and it's going to make it a lot smaller. The one way to fix it is they actually put in a chest tube, which you see here, and there's a video, which I'm going to kind of link you guys to watch on your own time. They put a chest tube in, and the air that's in this membrane will actually come pouring out, and that lung will refill, and you'll get something back like that. So it's really interesting how that works. You would think that they would fill the lung with air, but they don't do that. It's actually the air is on the outside of the lung, but it's trapped between the membranes, and it's pushing in on that lung to make it a lot smaller. We've seen this in the news lately, past few years, because of that terrible thing called vaping. And what really happens is some of the things that you get are these little air pockets that are on the lungs, and when they explode, that causes that air to get between those two membranes and really push in. It can be really scary because if both collapse, well, then you're not really gonna be able to breathe at all. Luckily, we have ways that we can kind of change that, and one of them is using one of these tubes. Okay, hopefully this helps. And I will be sending out review stuff for our test coming up. Thank you.